anyone gets. I haven't received
Yeah.
any link yet.
I've just said
Mm.
this is that you'll talk about the series that you are having and why we chose to have motherhood, pregnancy and mental done during this time. And then I'll come in and talk about motherhood and the mental health issues around it. Go in and then introduce our guests.
I just repeat, sorry.
Are you
Okay, repeat.
I'm saying you'll come in first and talk about issues on motherhood that you've had the whole month, and why we should do it at this time. Also, you can talk a little bit about Convocare and what we do, and then I'll come in and talk about mental health and motherhood, the issues behind the mental issues behind motherhood, and then introduce our guest.
Okay.
Yeah, imagine tuwe kama umepanic, relax. Ita flow too.
Yeah.
Don't let the camera.
Kidogo. Just a minute. I'm sorry, guys. I'm really sorry. Just a minute.
Okay, I've tried to share the link from my Facebook. I lead to the live.
Pardon?
Nasema I've tried sharing the link from my Facebook na ukiopen inaku direct kwa kulogin.
Inakunelekea kwa kulogin Facebook.
Yeah.
So, hey, switch on your cameras, ladies, please. So you know everything's good.
What inspired you to do this today?
What inspired me? We've been doing lives over. We are trying to do a live every week, by the end of every week. And then being Mother's Day was just at the start of the month.
Yeah.
It was wise to talk about motherhood during the month, and we see a lot of women experience a lot of changes when they have children, and most of them affect even their mental health. And it's a very important topic to discuss, especially now that we are celebrating mothers. Most people don't know what happens to a woman with children. Yeah.
Especially nothing usually prepares you.
Yeah. You just
Love this topic.
Hey,
Right. I believe we can now start earlier.
please mute your speakers. I don't know, someone has stated that they can hear us.
So hi everybody. Thank you so much for joining this live for today. We are so happy that we get to do this with you guys. So first of all, I'll talk about Convokia. Convokia is a mental health organization which offers therapy. We try to make therapy affordable, accessible, and available to everyone. So today we'll be talking about mental health, motherhood, and pregnancy. The reason as to why we chose today talking about mental health, motherhood, and pregnancy is because, first of all, it was Mother's Day this month, so we chose to focus about talking about motherhood, mental health, and pregnancy because when most people are pregnant or transitioning to motherhood, they don't know anything, especially the young moms, they don't know much about motherhood. So that's why this month we wanted to create awareness. So I hope this time will be a time of you learning, even if you're not a mother yet, you're getting there. So it's a good time for you to learn too. So I'll welcome our psychologist, Miss Daisy. Thank you so much for today. Karibu sana, you look gorgeous.
Thank you, thank you, thank you so much, Lulu. My name is Daisy Khaindi. I'm the lead counselor Convokia Kenya. And as always, I really appreciate my clients. I really appreciate the effort that you put towards working towards making yourself better and improving your mental health. I really appreciate you. You're doing a good job. So, as Lulu has said, we decided to have this forum today to talk about motherhood. Lulu and I are not mothers yet, but we have a guest.
Yeah, but we are heading there.
Yeah, we are heading there. We are heading there. We have a guest. She's a doctor and she's also a mother. And I think I'll introduce her a bit later during the forum. But we want to talk about motherhood and mental health. And most women experience a lot of changes in their bodies when they experience childbirth and the whole process of pregnancy, and to some extent it affects how a mother feels about themselves, how you perceive yourself because of the process of childbirth. I have had clients who are worried of how they will even take care of their children. I'm also talking about teenage mothers and pregnancy that happen before you planned for it, for instance. And so today will be our major topic, and we are going to give um, support to women who have had children and have issues with mental health. and give a few tactics on how to cope during pregnancy and even after childbirth. And I think having a guest who is also a mother, she can tell us how she coped and how she managed to maintain her mental health during pregnancy and even after child. Yeah, so we are going to talk about issues of your triggers so that you don't take post-traumatic stress disorder during pregnancy and childbirth. Yes. So maybe I'll start by talking about postpartum depression, which is a major topic of discussion, especially because there's a lot of hormonal changes in the body of a mother, and to add on it, the emotional experiences that women have that could cause women to be in postpartum depression after pregnancy. So after pregnancy and after childbirth. So you find that there is no the normal depression which mothers normally
There's a
have
lot of
that we
hormonal
sometimes
changes
is
in
called baby
the
blues,
body of
whereby mother,
women
and
get
to add
into
on it the emotion
outcries.
they feel a level of sadness, they feel a level of anxiety and worry about how they will take care of the children. They feel a sense of loss of self-esteem because of how the period of pregnancy was and the circumstances around it and also childbirth. So before I go too far, I think I'll introduce our guest today. I'll introduce
Yeah.
Nahya. Her name is Nahya. She'll tell us more what she does and maybe tell us about her motherhood experience. Yeah, she offers care for her company offers medical care for people from home. I mean, someone comes to your home
Wow.
to take
I
a
can imagine the baby girl lifestyle.
soft life.
Yeah, lifestyle. Yeah, soft life. I mean, you're just a phone call away. You're just like, hi, doc. You know what? Today I woke up having headaches. So where are you guys? They're like, we are 5 minutes away. And it's just like that. I mean, I think I love this because long are the days when we just go to, especially these public hospitals, and you're queuing and the headache, it's just too much. So these days things are so amazing, just smooth. Baby girl, enjoying baby girl lifestyle. Just wake
Mm-hmm.
up, phone call away, 5 minutes, then you're done.
Mm-hmm.
So yeah, this is something nice.
Yeah, the paramedic, and the organization has a nice innovation for mothers and
Wow.
and a whole package for the motherhood experience to help your body come
Ooh.
normal. So I'll introduce her. She'll introduce herself and tell us more. Yes,
Uh,
Kavi.
very Daisy and Lulu. My name is Nahya Mukami. I've been a paramedic for 11 years, and I founded an organization by the name House Call Medics, and I'm a co-CEO with another doctor. She's a plastic surgeon, Dr. Mukami. So yeah, like you said, our organization, what we do is we provide medical services, quality medical services at the comfort of someone's home, because we believe that everyone deserves quality medical services, whether you are able to go to the hospital or not. So we come to you.
Mm-hmm.
Yeah, yeah, yeah.
Yeah.
And me being a mother, it really inspired the package, the maternity package that we have, where, like you said, it's very hard, especially for new mothers, even if it's your second child. See,
Mm-hmm.
like before people used to go give birth in their homes, in their mom's homes and all that. But nowadays, as busy as it gets, you have to go back to work in like 3 months. Your mental health is
Yeah,
not okay.
it's
So, yeah. So right now we have people who decide, okay, me, I'll just give birth in my house, and maybe no one hands you a manual on how to take care of a baby. This is like we always say, the maternity wing is the only wing in the hospital where a patient has to take care of another patient.
Mm-hmm.
true.
Yeah, completely forget about the mother. Like the moment the baby is there, the nurses, the doctors, they're only focused on the baby, not understanding that even the mother needs the same care as
Yeah.
the new. This is a new thing. You've brought something, a human being into the world. You don't know where
Mm.
the hospital. Your body is so. You're being switched over there. It's like you're in a completely new world. Everyone is
Mm.
asking the baby. Yeah. So that really inspired the package and the house called Medics, where we start with you like 2 weeks before you give birth,
Mm-hmm.
and you're taken care of. You are shown how to like breastfeed. You start the classes, you start Lama's classes. You're being prepared for birth now. And then after that is when now after immediately you've given birth, the hospital that you're in, we come to you with the seatbelt of maternity. Now, what is the seatbelt of maternity? So many people might ask. So this is a medical innovation actually that has done well in the US in 15 states, and House Called Medix is trying to introduce it to Kenya because we feel like it's really going to help mothers a lot, especially with postpartum depression. It helps with falls. It makes sure you'll be so confident in even leaving your baby with your husband because it's unisex. So we're even trying to encourage your partners to help you with the baby so that you can get enough rest and you can be in the best mental state to take care of your child. It's FDA approved, so it's very safe. It's usable. No bacteria can grow on it. It's been tested. I feel like it's something that really needs to be out there to help young mothers. And it helps you be hands free. That means you can still do your daily chores. And apart from that, under the package, we have vaginal rejuvenation naturally. We want to get mothers to a point where they'll be like, oh my God, I love me being a mom. This is like, I love the changes in my body, to accept yourself, to love yourself. Because as a mom, I realized that the best way for you to be able to care for your child is for you to love yourself first. You have to accept
Yeah,
yourself.
that's
Changes, someone has to like make you understand that there'll be changes. It's not easy to take care of a baby. No one hands you a manual. You just have to wing it. But for you to get there, you have to like love yourself first and be in the right mental state.
wow. I really love what you guys are innovating because back then, like, we didn't have such things. It was just so hectic. Wow. I'm actually learning. I'm just like, oh my God, what are those things?
Yeah.
Just like asking myself, what?
So what do you mean love yourself more? Tell us more, like how would you love yourself more? Sometimes it's easier said than done.
Yeah.
Yeah.
It doesn't happen like overnight. So I'll just tell you a little bit about my journey to motherhood. So yeah, I got pregnant at 24, and I was having I knew nothing. Like no one told me, and no matter what people tell you about pregnancy and motherhood, everyone's experience is completely different. Like
Mm.
whatever you're going to experience is not what I'm going to experience. That's
Mm.
journey. That's yours. So whatever you learn, the little things that you learn, and whatever makes it better is what now is going to help you help another mom.
Mm.
Yeah. So my pregnancy was okay. I had a lot of depression because I didn't understand the changes in my body. I wake up one day, I'm okay. I wake up the next day, I'm moody. By the time I'm giving birth, I went natural, no epidural, nothing.
Mm.
So it wasn't easy. At some point I was begging for CS. And my mom was like, no, 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 you have to do it the natural way, and we'll make sure you heal very fast. I'm not saying that if you want to choose CS, it's not easy. It's hard because you still have to like take care of a wound for maybe more than 3 weeks. So
Mhm.
the soreness that comes with you now that comes in after giving birth. Not to mention putting the baby to latch on that boob is painful.
Mm,
Every pain. You feel like you're in shock. You have a newborn who's crying 24/7. You don't know when they're hungry. You don't
mm,
know if maybe you need to change the diaper. So you're like both you and your baby. Actually, your baby makes you learn a lot. You learn a lot from them because they guide you.
mm-hmm,
Yeah, and the one thing I learned is be the parent. Don't let your baby parent you.
mm-hmm, mm-hmm. Wow. Okay.
That was advice from my mom. My mom was like, put your put your baby on a schedule from a very young age.
Mm-hmm.
Breastfeed, like when you're in the hospital, they tell you maybe to breastfeed at after every 2 hours. When you get home, continue with that. Don't ignore it.
Mm-hmm.
Forget, because maybe you know, and you always need someone to take care of you. Like we said, that's why household medics, we have these people who can come to you and make sure you get enough sleep when you know you can trust. Of course, you can trust a doctor, you can trust a nurse, you can trust a paramedic for them to take care of your baby, for you to sleep. And the package includes you being given massages
Mm-hmm.
in the morning. Yeah, like full body massage. And the baby gets a massage too. So this helps the baby actually sleep very, very well. It helps with colic too.
Mm-hmm.
So once the baby is sleeping and the mom is, imagine being massaged and just taking a hot shower, someone has made like a meal plan for you. So you're sorted. You know that when I wake up, I know I already have food and it's balanced diet. Like I have someone here to take care of me and just me. That feels so good.
Mm-hmm.
He's sleeping. If you need we need to dispense medicine, we'll give it to you. Let's say if
Mm-hmm.
you have a wound, Dr. Mukami is a certified plastic surgeon. She'll be there to check your wound. You just like you get VIP treatment.
Mm-hmm.
And doc being a psychologist, you know that helps your mental health. And you're like, oh wow, okay. Then I think you feel good even when you're 100. Sometimes someone gives you your baby and you're like, do I really have to take care of this baby? Can
Mm-hmm.
someone else take the baby? And maybe I wish I could give someone else to breastfeed my kid, but I couldn't. I had to do it myself.
Mm-hmm.
Yeah, like so many falls. We haven't talked about newborn falls. Like a mom produces oxytocin, you feel so sleepy and you end up dropping your child. So the medical innovation we have helps you with that. So you have no fear of
Mm-hmm.
that ever happening. And at the same time, you're bonding with your child skin to skin, and you can still breastfeed while wearing the medical innovation.
Mm-hmm.
Yeah.
So,
So yes.
thank you so much for that. My question is, were you able to get that help when you were pregnant and when you had your child? Did you get that support? And yeah, how else did you manage to work on your mental health, being sober and being yourself?
Yeah. So I let me say I got the support 50% of the support I needed because my mom was there. Even her, she had her own things to do, but she guided me on what to do. And another thing is that you need your spouse there like 100% because the postpartum depression usually lingers on. It's not only in the newborn phase; it like continues. And
Mm,
mine continued for a while because after I gave birth to my firstborn, when she was like 7 months, I got pregnant with my second one.
mhm,
Have two under two. You have like a 1 year old and you have like a newborn. I was going crazy.
mhm,
I felt like I constantly needed people to talk to. I felt like my husband being there really helped.
mhm, mhm,
And my mom was such a rock for me. Like she guided me through. She would come, take the babies maybe, and just be there for me, talk to me. Because I used to call my grandma and I'm like, oh my God, I couldn't understand postpartum depression. I was like, I don't know how I feel. I talked like postpartum depression, you can have like 1,000 people there for you in one room, but you still feel like you have no one. I was talking to one of the patients and she was saying that she felt like she wanted to like strangle the child. But no one understood that it was postpartum depression. You feel like you don't want the child, you feel like you want to hit the you don't the hormones are going crazy. So you're like, oh my God, how do like I feel like mothers, that's why we don't even let you spend an hour alone in the hospital when you've called house call medics. Like we are there for you. There when you're giving birth and for us to like receive your baby and be there from the moment you're in the hospital to the moment you've been discharged to go to your place, we'll be there because it feels so good to give back and to be inspired by so many women to do, because now I understand better being a mom. I understand like what you need to relax, and the few mothers we've worked with, they're like they've been so happy with our services. The mental health part, I because you constantly need someone to talk to, and I feel like people need to start normalizing going for therapy when you're for you when you're pregnant, when you've given birth, when you just need it, when you feel like. That's why we have a platform where you can just call us, we book you, and the patient can come to you and talk to you about all that, because most mothers don't understand, because sometimes you like all the anger is directed towards your kids, and people don't understand that, oh my God, she's still going through postpartum depression, maybe these are mental health issues and she needs to see someone. No, people think that you're a bad mom. No, you're not a bad mother. Taking care of yourself, um, feeling. There's one thing that people usually talk about a lot. They say mom guilt. Like you feel guilty when you take care of yourself. You feel guilty when you eat something and you haven't given it to your kids. You feel guilty when you go out by yourself. No, for me, I've never felt that, because I feel like if I take care of myself, I'm going to give my kids 100%. And like whenever I've taken care of my mental health and I'm happy, I can see the happiness in their face. Like, oh, mama is very happy today. Oh, mom, oh, mom, where did you go? Like they are excited to listen to what I've done, how my day was, as opposed to me not taking my me time and coming home and being so angry at them. And they're young, they don't understand what's happening.
Yeah, that's very important.
Yeah, postpartum depression usually lingers on. Be selfish. One of my friends usually says, "Be selfish with your. Be selfish. If you want something, go for it. As a mom, especially as a mom, if you want something, please go for it. If you need a break, if you have sisters, if you have a mom, tell them, please take my week. Let me reset. I'll come back for them. That's allowed. And it even when they grow up, they'll be like, oh wow, my mom used to take time off, so I'm gonna do the same. Yeah. Yeah, it's crazy. The postpartum depression, you feel like actually, I like talking about this whenever we have the girly camps and everything. One of the ladies was saying that most people who commit suicide, they don't do it because they want to die. They do it because they want attention.
True.
When you are having postpartum, you actually get those suicidal thoughts. You feel like maybe you not being there is going to help. You always just want to be away from everyone. So how do I do that? I have a new. You feel stuck. You have a newborn who needs you, completely dependent on you. You have no career. You can't go back to work because you're stuck in the house.
Talk about the
Yeah, exactly. Like when you're used to going out with friends, you can't do that anymore.
sleepless nights and a lot of sleep.
Oh,
Lack of sleep.
yeah, lack of sleep. Like you feel like you're going crazy. Literally. You're like, oh my God, you haven't slept, you feel like a zombie. You have a baby who's crying 24/7. You don't know if they are colicky, you don't know if they are sick, you don't know if they are hungry. Like no one hands you a manual to help you with that. So imagine if you could like have everything under one roof. you have a psychologist, Dr. Daisy, you have us, and someone can just come talk to you. You're getting the services. You feel so good. You even want to have like another kid and all that. Yeah, because you feel like you're getting the hang of things, right? Because when if you have your firstborn and everything is easy, oh my God, the second one is going to be a difficult. It's like a trick. Yeah,
Right.
and you don't usually get things right all the time as a mother, but you always try your best. Like I really like celebrating moms out there.
So maybe let me paraphrase a little bit of what Dr. Naya has said on noticing that you're going through postpartum depression and trying to get all the support that you need around you. She has talked about her being able to talk to her spouse, her mom, taking care of herself during pregnancy and after, like being able to take care of yourself, learn to appreciate yourself. It is a very huge milestone to have your first child, so you need to give yourself
Yeah.
that. And among other things, self-care, getting medical assistance. House call medics are there to give you a whole package, and if you cannot get to them, getting medical assistance and someone to always check up on you is a very good way to be able to maintain your mental health. Also, she has talked about finding therapy and like seeking help from a professional who can be able to help you talk through the emotional things around pregnancy. Sometimes you could be having issues from your past. I want to talk about mothers who maybe had a miscarriage or lost their children. Also, abortions could be an emotional issue that women experience during pregnancy and during childbirth as well. So having a way to be able to get a professional help or assistance, be able to deal with everything else around pregnancy and the emotional bit of it can help you to be able to maintain yourself. To like, I see most women sometimes lose themselves into motherhood, and you can learn to not lose yourself
Yeah.
into motherhood. I think Dr. Naya will also tell us about that. Be able to like maintain who you are. Yeah, maybe you can talk also about that.
So I know, you see, with us women, the little things actually they make us happy. Whatever makes you feel happy. If doing a skincare routine makes you feel happy, please go for it. If waking up an hour early to maybe have a cup of coffee, reflect on life, write whatever you're feeling down. Like for me, I used to like before I gave, I used to like working out. So that is one thing I was like, this is the one thing. It doesn't matter whether I'm a mom of 5 or a mom of 10 or 2, I'm still gonna maintain that. And that usually helps me a lot. If you work out, get that body back. It's you.
Mm.
Therapy, talk to someone, tell
Yeah.
them how you're feeling. You see, sometimes we think that having a bad day is not worth calling a therapist for. It is, if it's gonna make you harm yourself.
Mm.
Like you want to go out for that cup of coffee with your friends, please do get a babysitter to like stay with your kid for like maybe an hour. Go ahead and do that. Talk, if you have someone who's close to you, try and talk to them. I know I call my sister for the most minute things. Like I'll just call her if I'm just having a bad day and she will just talk to me and I'll be okay, or my mom or my friend. So I feel like just in general, a step at a time. Nothing happens overnight.
Mm-hmm.
Yeah. Nothing
Yeah.
happens overnight. I usually tell people the story of Kerito Gold and how the tea bags helped me get over a few postpartum depression. People are like, huh? What do you mean like a tea bag help? No, for me, that moment alone after my kids have gone to bed and I just sit down and have a cup of tea, that helps me. And it just makes me feel like a whole new human being.
Mm-hmm.
Plus, I'm in emergency 20 Mondays to Sunday. So even me going out there and helping another mom or responding to an emergency, just do whatever makes you feel good. Whatever you do, people will forever judge. Like where some of the people we were talking to about going for therapy, they were saying, watu wataniona kama mimi niko na wazimu naenda kuona daktari wa akili. I was like, no. That's for you. It's not for them. You take care of yourself. No matter what you do, at the end of the day, people are going to judge. No matter how good of a mom you are, someone else will come in with their own advice and they'll make you feel like you're doing nothing when you're giving 100%. Maybe me giving 100% is my 5 minutes for my kids. That's me giving that's my 100%. Maybe your 100% is you being a housewife or a mom 24/7, or not having time for yourself and just making sure that your kids are 100%. But first thing, you come first. You're enough. You can never give from an empty cup.
Wow. You can never give from an empty cup.
Exactly. Yeah. Yours has to be full for you to be able to like bless others.
That's true. Thank you everyone for joining. We appreciate you. We love you. You can send in your contributions or your questions so we can be able to answer them. We have professionals here with us who can respond to those questions. So please feel free to ask questions even as we go on. I want to talk about post traumatic stress disorder during pregnancy.
Yeah.
During childbirth. So post traumatic stress disorder is like when you're having trauma, when you have traumatic experience, what comes after is a series of maybe flashbacks, nightmares, anxiety that comes alongside stress and panic. That so when you're having trauma, your body kind of freezes or goes into flight or fights, and so a trigger would make you feel like you are going through the trauma again. So during pregnancy, you're likely to go through post-traumatic stress disorder if you had a bad experience during a past pregnancy. For instance, you lost a child, and I'm so sorry for talking about this. This could be triggering. I'm talking about maybe you lost a child, maybe you lost a baby through a miscarriage, and now having another pregnancy could be a reminder of what you went through. Maybe you had a very bad experience during childbirth, and that kind of traumatized you. And so, as a mother who is having another pregnancy, you'll be scared as a body response, or you could get into panic of the fact that you lost a child again. And this is a very big issue to mental health, because it could go to the extreme of you not wanting the child, and even when you give birth, you get into postpartum depression or postpartum psychosis. And there are ways you can cope with that by identifying that you're actually getting triggered. And the signs of post-traumatic stress are like constant flashbacks, having nightmares, having constant fear or anxiety, and it's unhealthy for the mother and even for the child. And so as a mother going through this, it's very important for you to be able to notice that you are, and seek help. And by seeking help, I mean being able to talk about it to someone or a professional, and also being able to self-regulate. And by self-regulating, I mean being able to notice that when you're going through the triggers, what is triggering it, and like talk yourself through the anxiety and bring yourself back to a level of calmness. So I don't know Naya, you had any triggers?
The with my firstborn, not really. I feel like everything was smooth, but well, the one thing that I was really scared of was pushing because
Uh-huh.
yeah, exactly. So it wasn't easy with my firstborn. So I was like, oh my God, am I going to get an episiotomy again? How is this going to go? How is this going to go? Am I going to be okay? The stress, and I was having the stress when I was already pregnant with my second born.
Mm-hmm. Hello. I think we lost you for a while. Hello, Dr. Naya. Are you still with us? Well, we were talking about um, triggers and post-traumatic stress disorder during pregnancy, and Dr. Naya was sharing a bit of her own story, and about how you can self-regulate when you have triggers by talking yourself through it, stating it out. So, for instance, you feel you're panicking, you feel you're sweating, you're scared about something. You can self-regulate by stating it out, and a very good way to state it out is to write it down. Write down that I am actually anxious because maybe in the past I didn't have a very easy pregnancy. I'm scared that this one too will stating up talking about how you feel to someone. um there's a way you can also ground yourself, like return yourself back to the moment by having an object or a phrase that you keep on saying and telling yourself so that you can self-regulate. Dr. Naya, we're glad to have you back. We lost you for a while.
Yeah,
Mhm.
connection broke.
Yeah, okay, you can go on.
Yeah, so like I was saying, and this feels so good to talk about. I actually, with my firstborn, it was easy, but like I said, I was scared of the pushing part. And when the baby was coming out, it's painful. And so I was stressing while I'm pregnant with my second born, and
Mm,
this the stress made her come early, and
mm, yeah,
uh,
okay,
I
you can
actually
go
ended
on.
up. Yeah, so
Mm,
giving back by myself. Like I had to push and pull my baby out
oh.
because because I was having an emergency and I really didn't want to go through a CS. They were saying I was going to say I was like, oh, government hospitals are the best because they won't baby you and take you for a CS because you want one. I was like, please guys, take me to Pumwani. Like I was begging for it.
Mm, mhm,
It's so chill. Like you saying, "Oh my goodness, my baby is coming, my baby is coming." By the time I'm calling the nurse, and the nurse is like, "Ah, tutakuja, tutakuja." The baby, I was already pushing. I pushed the baby out. By the time she was realizing I'm a medic, she's like, "Oh wow, we didn't know you're a medic." So I was like, "No, no, no, no. Doesn't matter whether someone is a medic or not. You guys have to be there.
mm,
Important to go with someone, either your husband, your mom, or your sister, or a friend."
mhm,
Just tell them to stick around. The fact that in the back of my mind, I knew that my mom was around.
mhm,
The only thing that actually kept me calm.
mhm,
Like, oh my God, thank God, at least my mom, my mom is around and maybe she can hear my screams and all that.
mhm,
Yeah. So, yeah, that actually it actually messed me up because I'm like, oh my God, when it comes to a third one, I don't know what I'm going to do because that was just too much.
mhm,
It actually messes with your head. Most people don't understand that. Because you'll hear people talk about it very casually. Like you'll hear women talk about it very casually. They'll be like, Oh my God. The only thing I'm afraid of is going to push. Oh my God. I'm like, oh, I am so afraid of that.
Mm-hmm.
You actually need to talk to someone about these things.
Yeah.
Not to mention, you always think that you're going to die. I want people to talk about this as much as possible. When you're giving birth, when you're going to give birth, you feel like
Mm-hmm.
you're signing a death warrant. You feel like, oh my God, this is it. That's it for me. Like,
Mm-hmm.
am I going to come back from this? So, and you actually, some women think about this for the whole 9 months.
Wow.
When you go to these hospitals or when you talk to teenage mothers, like we have an amazing lady, her name is Njeri. She has an organization called Dunda Dada.
Mm-hmm.
She helps young teenage mothers go back to school after they've given birth. Imagine someone who's like 13 years, a 13-year-old giving birth, they know nothing. First of
Mm,
all, I doubt if you even know anything about your own body.
true.
Mhm.
And bringing up a child probably on.
And stigmatization, yeah. And you're worried about so many things. How am I gonna feed this kid? I'm 13. I don't have a job. Still in school. Maybe the partner has decided, oh no, I'm not going to like get involved with this.
Mm. So how did you handle that?
Doc, to tell you the truth, I
Uh-huh.
just strong. I can't say I handled it, but I
Mm.
was like, you know what? This this is something that I have to go through. I have to face it. Sure, this is what I need to do, and yeah.
Well, I'm actually shocked that you gave birth on your own. I always see it in movies, and I'm like, hey, this is hard.
There's one thing that people that actually so many women need to understand is that the way God has created you and God putting another human being in you, that means everything is it's not easy, but the baby actually comes out by itself. The nurse, the doctor is only there to support.
Mm-hmm.
They're
Mm-hmm.
support.
Mm.
So many women used to give birth in their houses.
Yeah.
It's just that now we can't because of so many infections.
Mm-hmm.
To be in a hospital setting because anything can happen. Yeah.
Wow. 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 I'm still shocked. Anyway, thank you again, everybody, for joining. We are accepting questions. We are here for you, as always. You can, as you continue with the live, you can type in your question and follow us, follow House Call Medics, follow Convo Care if you haven't, and give us and share, tell a friend to tell a friend, even as we work towards creating a society with better mental health, where people are aware of their mental health issues. Yes. I would want us to talk about the last thing before we end our session for today, and I'd like to talk about abortion, and just not abortion. I want us to talk about how it affects proceeding pregnancies. So
Um,
how you get.
Dr. B,
Uh huh.
let me before we continue, I just wanted to ask Doc here, how are you doing exercise and was it helpful during that journey? Maybe before and after you can talk about maybe how your exercise routine was during and after. So that's
So
something I feel like that's something people usually neglect and it's very important. Maybe you can actually touch on it before and after.
yeah. So okay. I feel okay from my experience. There's a certain way when you want to give birth, when you're planning to like conceive. there's a certain weight that if you maintain, it will be so hard for you to go back to being yourself. Yeah. So when you do that, like start exercising, eat healthy before you decide you want to be a mother. Like deal with your mental state. Make sure you're in the best mental state. And there are things you see, okay. One of the things that women are usually so like worried about is your tummy.
Mm-hmm.
Never hear
Yeah,
anyone.
that's true. We all like
Yeah,
feel
you
like
never
we
hear
have
anyone
that.
complaining about, oh, when I give birth, I'm gonna have big hips. I don't want big hips, or I don't want a big bum. No, you'll never hear that, but you'll hear about, oh, me, I don't want.
Big time.
So actually, you can for us to have the package under household medics, it's something that has been researched dearly for 10 years. So for you to be, there are things that you're supposed to take when you've given birth, and there are things that you're supposed to stay away from. Cold water is your number one enemy. If you want a flat tummy, 2 weeks postpartum, cold water is your number one enemy. Like, stick to soups, porridge. So and there's for you something else we sell under household tech when you've given birth, and there are things that you're supposed to stay away from throughout the maybe the 3 months. You have 5 kids or 10 kids, you'll still have the flat tummy that you want.
Wow.
Consult your start pole pole, like a step at a time with the exercises. Don't go too rough and don't go too fast. Start with you maybe dieting a little, which we also provide that. And then we send you an exercise regime, a diet plan for like, we start you with like pole pole, a week, 2 weeks, 3 weeks, 4 weeks, because you're supposed to take care of yourself physically and mentally.
Wow.
One day thing, but if you want the changes immediately you've given birth, like immediately you've given birth, please just give us a call. The wrong things and you don't end up. Plus, you need to have hopes and not expectations, and you have to work towards your goal. Consulting a doctor.
Wow.
Wow, I love
We
it.
go
And
with
right now I feel like anytime I can call you very soon.
with you for like 6 months to a point where even we go with you, we follow your journey until 6 months where your baby's where you start weaning your baby. So that our package, we even provide for you what to cook for your child, meal plans for your child. It reduces the stress. Honestly, it does.
Wow,
So
that's a nice
you know,
package.
for the next 6 months, me, I'm sorted.
Yeah, that's very important because the way people used to do things kienyeji back then, hey, it used to be scary. I'm just like, wow, this is motherhood. Like, oof, I better get a manual. And this is very important. Like, a lot of people have not been talking about motherhood and the challenges. People are just like, okay, you need to um just step up and be strong, but you can't be strong for your kid when you're not okay, like even mentally, physically, and also emotionally. You need to be well, like all round. So I feel it's very necessary for every mother to go through, can I say, classes maybe before pregnancy, pre and post. Yeah.
Important things you're talking about. And when she talked about physical exercises, I was like, that's a very good way to solve many issues. So for instance, you're having issues self-esteem, You're thinking, how about my tummy? Will it be big? Will I have issues with my how I
I know.
feel? When you
Even right now, we are having insecurities. Sorry about after.
so when you exercise, you're already dealing with that bit of the tummy. While you're working on yourself and maintaining your tummy and how you look, you're also working on things like tension, because physical exercises help you to release tension, and
Yeah.
that's very common in pregnancy. You have a lot of tension inside your body, leave alone the stress bit of it. So I think physical exercises are very important and a very good way to self-regulate and like put yourself in that, like align yourself. Yeah, so I was also talking about abortions and how it sometimes it triggers you during pregnancy, and the issues of mental health that come alongside abortions, and not just abortions that you have to do. I'm also talking about when you have had to terminate a pregnancy because of a health condition. um, I'm talking
Yeah,
about
ectopic pregnancy.
like ectopic pregnancies. Yeah, and I'm talking about how you can support yourself. You can learn to be aware of the mental impact that it has. So and so during pregnancy, when you're having now pregnancy, you have terminated another, you could get triggered from time to time. You could get anxious and like blame yourself. And first, I would like to congratulate another who has been able to contain themselves. You know, it's hard. For instance, if you've had to terminate a pregnancy, the emotional bit that comes alongside it is not easy, and it's very important to deal with these issues. So a professional can help you to be able to talk about, and even if you cannot have access to a mental health practitioner or someone to help you, it's important for you to learn to release, like to release yourself. A very good way to do that is to forgive yourself by writing
Mm-hmm.
a letter to yourself and releasing that bit, release that child, because our bodies are not coffins for us to store pain and guilt. So getting to a point of forgiving yourself for that, be it you wanted it or you did not, or you had to, get to a point to first forgive yourself and accept that it happened, and welcome new occurrences, just not remaining on the disappointments of the past. Yes, you can be able to ensure you have a good mental health by reaching that level. I don't know if I guess, and Lulu can add on that.
Okay.
Once again, I really appreciate everyone who joined today. We will be having giveaways on our next live, and I hope you will continue joining us to enjoy our goodies and to get the information that we give. Yes.
Okay, um so since it was Mother's Day, I believe that maybe some mothers may be going through different like changes and transitions, and it's not easy to actually cope. So our doctor in the house has something for us, some nice package for us. So maybe she can tell us about it. Doc Naya.
Yeah. So what we are going to do for the we had a package for Mother's Day that we were supposed to gift to one of the moms. So we will rely on you guys to look for a mom that we can gift this package with for like a week. We can give her the service for like a week, and we can give her a nice hamper.
Wow. I wish I was a mother.
That is nice. That's
Yeah.
so yeah, that's like, oh my god, mom in the building. I'm just like, do I
So we
look
need,
like a mom to be qualified in this offer?
we need a new mother. We need a new mother. Yeah. We can give
New
to
mothers, if you're a new mother and watching this, tell us the reason as to why we need to give you this package. Imagine free baby girl. I don't know how to describe it. Free baby girl package. I mean, like, who doesn't want that? Me, being a baby girl, like, I want that lifestyle. And
we can
imagine,
give
like,
new
transitioning
mothers.
to
If you're a
motherhood,
new
you're a
mother
new
and
mom,
watching
and
this,
you don't
tell
know
us the
anything
reason
about this,
as to
and
why
you
we
feel
need
like,
to
you
give
know
you
what,
this
I feel like
package.
life is
Imagine
just
free
crumbling down right now,
baby
and
girl.
I need someone to guide me and take me through every detail of motherhood. So if
Free
you're a
baby
new
girl
mom
package. I
and
mean,
you are experiencing
like, who
that
doesn't want
transition
that?
and you want
Me,
this
being a baby
package,
girl, like, I want that
baby
lifestyle. And
girl,
imagine,
new
like,
baby
if
girl,
you're a new mother
just
and
put
watching
out
this,
and
tell
you
us
don't
the
know
reason
anything
as
about
to
this,
why
and
we
you
need
feel
to
like,
give
you
you
know
this
what, I feel
package.
like
So
life is
imagine
just
or you can
crumbling down
recommend
right now, and
someone
I need someone to
else. We'll
guide
post
me and
it.
take me
You'll
through
get, I don't
every
know how to
detail
describe
of
it.
mother, and we'll just post every detail on both social media, both Convocare and House Call Medics. So, guys, like, who doesn't love a free hamper? So tell us the reason as to why. I'll hand it over to Dr. Daisy. Don't know if she has some free packages for us,
Yes, yes,
which she
yes,
can
yes.
tell us. Let's see if she will surprise us. Ooh.
In the light of motherhood and celebrating this month as a mother's month, I would like to offer free therapy for one mom who I feel everybody deserves therapy. So this will be hard, but I am offering free therapy sessions, at least
Mm-hmm.
two therapy sessions for a mom who would like someone to who can listen to her, a mother's
Yeah,
month.
I feel like what we need to do, we
I
need to
would like to
find that one mother who really deserves this, and we can go together as we are delivering the hamper and the
Yeah.
you can give the therapy. Yeah,
wow, wow, wow,
yeah.
Ah,
awesome.
wow. That's so nice.
Yeah.
Hey,
Um,
people, I feel like I can. I feel tempted to say I am one of them, but I'm not getting there. Man, this free hamper, like, I'm just trying to imagine how comfortable is it just getting a doctor, like, catering for your nutrition and everything. Back then I used to see, like, I have taken care of two niece and my brother, and it wasn't easy. I remember those days when we used to wake up in the middle of the night, like doing a shift. One person will take care of this, one person will take care of this person at this particular time. And I'm just like, I'm also in school. At that time, I was in primary. So you can imagine the stress of a primary child waking up at 12. You need to go to school tomorrow morning, or you need to do certain duties maybe the next day, and you're not a mom, you don't have any knowledge, but you found yourself there and you're taking care of a new baby and you're also a baby. So that was just, I wouldn't say it was a learning experience, but for me it was a horrible experience. Sleeping, it alters your, like, sleeping patterns. By the time you're waking up, you feel so exhausted. And I was just trying to imagine, is this how motherhood is like I felt like motherhood is kind of horrible because the stress of not sleeping, that's my main concern. I was just like babies crying day in, day out, like at night. I don't know why babies are crying at night. I don't understand. Is there any theory behind it? Or is it just natural?
No,
I
actually,
think there's a theory. I don't know. Is there any theory behind all?
when we started this conversation, I was saying that you need to be the parent and not let your baby parent you. You can't stop a child from crying at night, but you can actually work on the sleeping schedule. Like during the day, make sure wherever your baby is sleeping, there is noise and it's bright.
Wow, there's noise.
Yes, and it's bright. But at night, make sure the place is like silence and it's dark. So that the
Mm,
baby can differentiate that, oh, at night I need to sleep, during the day it's just a nap.
wow.
Make sure they are well fed. I think one of the number one reason babies cry is either if they are calling,
Okay.
if they are not full. Like breast milk usually digest.
Wow.
So babies who are being breastfed, they tend to get hungry very quickly. That's why you have to keep on breastfeeding after every 2 hours. After every 2 hours, the baby massages. I will never insist this enough. Baby massages help. That's what my babies never used to cry at night.
Wow.
Because you give them a bath maybe at 6, you massage them, you make sure
Wow.
they're fed. If you need to give the gas drops, you give, and then you let them sleep.
Mm-hmm.
Yeah, they won't disturb you.
Wow.
They'll maybe wake up.
Imagine those are the things.
Yeah, they'll wake up a few times to feed, and that's it.
Wow, 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 wow.
Yeah.
Awesome.
Wow.
Well, I've learned a lot,
I'm
honestly.
taking notes. Even me, I'm just like, hiya, kumbe this happens. I just assume it's like the normal. The baby maybe wants. I used to feel like the baby needs more attention at night, and I'm like, it's at night. Why do you need attention for crying out loud? Even me, I'm trying to like get adequate sleep, and you're here. Both of us we need attention.
Both
So
of us.
relax. So that was my only reason. I'm just like, why are you?
And you see, Doc,
We need attention, both of us. So no competition here. Says be calm.
if
Mm,
your baby sleeps, actually you get time with your partner, and even that helps with your mental health. It really does, because if we focus more on the baby. Did you know that men usually get postpartum depression too?
yes, yes, yes. I was reading that somewhere.
Yep, men do. Because for the first 6 months, it's the
Wow.
mom who's usually with the baby. The dad doesn't get time to bond with the child, and that is the reason why we have these EGs that's unisex.
Mm,
Yeah, you see, even like when you're tired, your husband can't bond with your child while wearing bond skin to skin, and
mm,
like you're both winning. He's with the child, you sleep, they're bonding. If he sleeps, he can't drop the baby. Men are usually afraid of carrying newborns with the fear of dropping them.
wow.
Yeah, and that is why we are so excited to introduce this, because then it helps. There is no fear when your child is strapped on your chest,
Mm-hmm.
like the baby won't fall.
Mm-hmm.
You sleep very comfortably, you're okay, and you both end up getting like enough sleep.
Wow.
Yeah.
Wow. A very nice innovation there. I don't know if I was a mom, I would have scooped it right
I
now.
know.
Lulu, your camera is off, I think. Yeah, okay. So I'll read a comment that we
Okay.
have. This is so nice. Thank you, Dr. Daisy and Dr. Nahya, for talking about this. I'm watching you and hoping that many young mothers are watching and will feel helped at the end. Keep on with that, with what you're doing. helping the society. This is from my mom. I'm so excited. Thank you so much.
Yeah.
Wow. So I think we'll come to the end of our session. It was a nice session. Thank you so much, Dr. Na and Lulu, for joining us today. It was an awesome experience. We are looking forward to more of partnerships. Remember, we always care. We care for you. And House Call Medics cares for everybody else. They can get to you from your home and help you take care of yourself in terms of your health, in terms of being a mom. And we really appreciate the work you're doing. Thank you
Thank
so
you
much.
very much. Thank you, Doc.
So we'll see you on our live next time. I've said on our next live, we'll have a giveaway as well. So be sure to join us and catch us when you can. Okay, so bye, Natalie Lulu. Maybe something and then we can finish with Dr. Na and then we close. Maybe Dr. Na, you can give us your closing remarks.
I know. Thank you very much, you guys, for tuning in. This has been thank you, Dr. Daisy, for inviting me to this. It was. I hope people have learned something
Yeah.
every day. And at Household Medics, your health is always our priority, and you're always here for you. Give us a call anytime.
Wow.
Yeah,
Thank you so much.
welcome.
We'll see you next time. Bye.
What's up, people? Welcome to the Naked Ego podcast. My name is Cassandra Bill. I'm your host. And
Edgar Jambo, your co-host.
yes, this is a platform where men and women are willing to strip down their ego and be authentic and vulnerable while they share their stories. Today, we're going to talk about trauma
And healing.
and healing. And when you talk about trauma and healing, there is no better person to talk about trauma and healing than Daisy Khaindi. How are you?
I'm very fine.
Welcome to the podcast.
Thank you.
How are you feeling? This is the Naked Ego podcast. Yeah. So
Feel at home, feel relaxed.
yes,
You know.
yeah.
But yeah, tell us a little bit more
And
about
also
yourself.
have fun while at it.
Yes, have fun. Yeah.
So Daisy, introduce yourself.
When you said feel at home, feel relaxed, it felt so therapeutic.
Uh-huh.
Yeah. There you go.
Because I keep telling my clients,
Yeah.
feel at home. I'm
Yeah.
here for you.
There you go.
Yeah. So I'm Daisy Khaindi,
Yeah.
proudly Luya.
Yeah.